Hello, hello, hello. It's me, Dr. Catherine Toomer, family medicine and community health physician. Oops, and there's my my alarm just went off. Ah. So, in case I forgot that I was supposed to do this at 7 o'clock, I had an alarm. All right. So again, I'm Dr. Catherine Toomer. I tell you, if it's not one thing, it's another. And I'm here for Dr. Toomer Talks on Tuesday. And you got me to myself again. I'm traveling and I'm not in prison, I promise. I know this looks strange behind me. Hello, Chris. Thank you for joining again. Um, so, one of what I was going to talk about, because I'm getting a lot of questions about GLP-1s, the medications that are out, like Ozempic, Manjaro, the new one that has just been designated by the FDA for weight loss, Zepbound. Wegovy is the older one. We have Trulicity, and there's Saxenda, Victoza. There's um, Ribelsis, which is the pill version. And the reason why I want to talk about them is because, for a couple of reasons. One, they've been around for 20 years, and yet people are scared of them as if they don't know what they're going to do or how they're going to behave. In 20 years we're going to find out that it causes cancer. Well, they've been out for 20 years. We've been using GLP-1s for many, many years for diabetes, and if anything, it does the opposite. Because of their cardiovascular and their blood sugar control, they actually help with small vessel disease. So, microvascular dementia is improved or prevented. Diabetes is improved or prevented. All the different things that happen with diabetes, like high cholesterol or triglycerides, kidney failure, kidney insufficiency, or heart failure, all of those things are improved when using the medication. So I just wanted to talk a little bit about them because they're getting a lot of bad press. And part of the reason why that's happening, every time I hear about something happening, usually it's assigned to Ozempic, which may or may not be Ozempic. I suspect that many times people use the term Ozempic because that's the only medication they know, just like how we say Vaseline for petroleum jelly, or some people say Coke for any soda. We just say your Band-Aid. We just use brand names for things that are in the same class of that medication. And so I think a lot of people are saying Ozempic. And so every time I see someone who has an adverse reaction that's really serious, fatal, in fact, more often than not, there's a misuse of the medication. It's either misused or it was under monitored by whoever prescribed the medication. So, but what they do is they actually help our body. It blocks our body from making fat. GLP-1s and Manjaro, which is a GLP-1 and a GIP, what they do is our body takes carbohydrates, gets broken down into glucose, which is blood sugar. That blood sugar is then taken and turned into fat, usually with the help of insulin, but particularly when if that glucose can't get into a cell to give it energy, then what happens is the insulin then is used to turn it into fat. And that's why insulin resistance, which is basically our cell's inability to use insulin, keeps the glucose in our blood rather than getting it into the cell, and therefore it gets taken and turned into fat. So, what these medications do is they make the cell sensitive to the insulin that your body produces. It helps your body produce more insulin, and it makes your body more sensitive to that insulin, so that instead of being turned into fat, the glucose is used for energy. That's what it's supposed to do. Now, there are genetic components as to why this doesn't happen. It's why, if you have two people who eat the exact same thing, one may or may not gain any weight and the other one does. And the reason that is because of genetics. So often, what happens is when there's a perfect storm or perfect combination of genetics meets environment, then often what happens is fat production and obesity. Now, insulin resistance is at the low end of diabetes. Diabetes mellitus is at the top end, but they're all the same continuum, and that's why the medications generally work really, really well to help with weight loss. And the way you can tell if you're insulin resistant, there's a couple of signs. One of them is by darkening around the base of the neck is one. The other is getting really sleepy or very irritable after eating when your blood sugar tends to shoot up. The other is often having, well, at later stages, particularly with diabetes, having sores that won't heal. Starting to notice that your fingers and toes are cold, and the circulation's not that great. Gaining weight through the middle, just through the middle or under your chin or behind your neck. And the reason those are, it's called a Cushingoid, and that's because cortisol, a stress hormone, also causes insulin resistance. And high cortisol also gives you that Cushingoid effect appearance. Fat around the face, fat behind the neck, fat around the middle. And so if you're someone who gains weight very, very easily, but it's very difficult for you to lose it, you very well might have insulin resistance. Unfortunately, it doesn't show up in normal blood tests. Most of the time when we get blood tests, we get them done fasting. But insulin resistance is a food related condition. And so you can't tell if it's there during fasting because your blood sugars are going to be low, your insulin levels are going to be low. So the way to find insulin resistance is to get what's called a glucose tolerance test. I prefer 1 hour glucose tolerance test just because 2 hours, who has time to sit around for 2 hours? Um, and so 1 hour glucose tolerance test. And at the time of the second glucose draw, which is at 1 hour, that's when the free insulin is also checked. And usually what happens is you'll find that either the glucose is high, the insulin levels are high, or both. And that proves that there's some issue with glucose dysregulation, and that's why these medications would be effective. Now, some people say, well, it decreases appetite. It does, but it decreases appetite when that appetite's driven by glucose in the brain or insulin resistance and the brain not getting its glucose, and therefore it kind of drives us to want to eat. The only part that's not glucose dysregulation related is the mechanical part, and that's with the gut motility. And actually, that's what causes a lot of the side effects. The constipation, the nausea are the two most common, reflux. Um, and so, but those symptoms generally go away. And the way you use these medications is you start with a very, very low dose, and then you slowly titrate up until you get to the maximum dose. Now, the reason you start at the lowest dose, it's not supposed to do anything other than prime your body so that at higher doses you don't have side effects. So there should be no expectation of anything at the lowest dose other than to not have side effects. So if you do have side effects at the lowest dose, it's really important to stay there until those side effects go away. Usually it's nausea, like I said, diarrhea or constipation is more common. And so as you go up to each dose, then you start noticing the effects of that dose. And one of the things that's very, very important is two things actually. Eat enough calories. You don't want your weight loss to be from undereating. You don't want your weight loss to be from malnourishment, because what happens is your body will go after your organs for what it needs, particularly your muscle. You need your muscle for metabolism. So if your body goes after muscle because it's not getting enough protein, then it just defeats the whole purpose. It takes a healthy process and makes it an unhealthy one. And not only that, it makes it almost impossible to keep the weight off, even with medication. So it's really important. And then the second thing is not to lose muscle, but also to build it. So when you are on a GLP-1, now your body is not fighting against this metabolic process going on. And so your muscles get really efficient at building. And so when your body gets really efficient, now's the time to build. So once you start getting treated, then you start building your muscle. Two things will happen. One, it could help with not being able to come off the medication. And then two, the is that it will help prevent all the other, it's just a natural, it's actually a natural medicine in and of itself. Muscle as medicine. And so building muscle is one of the healthier things you can do, not just for you now, but also for when you're 90. Hello, Dr. Una. You know the reference. Hello, Don. How are you? So there's a couple of things. So one, making sure that you have what it is that requires the medication, and that is, like I said, a glucose tolerance test, hemoglobin A1C to make see where you fall in the continuum, and also a free insulin at the 1 hour mark. Then taking the medication as it's prescribed, not any other way, not with any um, other medication. Focus on getting your body back to its baseline. And then once it's there, then you start building muscle. Now, that's assuming you have some glucose dysregulation. If you don't, muscle will do this on its own. If you just build muscle, it will help regulate your glucose just in and of itself. It gives off chemicals, it increases your metabolism. It is just a wonderful tool. It prevents falling, it makes you strong. Building muscle when you're younger will help you when you're older. In fact, there's a study that says what you do before 50 will determine what happens to you after 75. So, building muscle. So, again, there's nothing wrong with taking GLP-1s if you need them. So if you're someone who gains weight very easily, has difficulty losing it, and you can't figure out why, whether it's just, and then people say, well, it's because of menopause. Well, yeah, but the reason menopause causes weight gain is because it also causes insulin resistance. Um, if you have polycystic ovaries, same thing, same reason. If you're pre-diabetic or pre-diabetic, same thing, same reason. And so, again, low dose doesn't do a whole lot other than get your body ready for higher doses. And then it starts doing what it's supposed to do. And you'll start noticing not just your blood sugars regulating, because most of us don't know what that feels like, but you start to notice other things going away, like inflammation, like headaches, like difficulty with your kidneys or your heart. Blood pressure starts to drop. People have to come off their medications often or lower their doses. So there's a lot of secondary benefits. And so people call it the skinny shot. It's an unfortunate name for a very, very beneficial medication. But those who are using it, be proud because you're taking control of your health, and just know that that's what they're for. They're to help you get healthy and to live a much happier and more fulfilled and healthier life. So, again, I'm Dr. Catherine Toomer, founder of Total Weight Care Institute. And I also have programs in that I have for anyone who's interested in trying to get healthy, wants to maximize their health and wellness through weight loss. If you are truly trying to get healthy, can't figure out why, can't figure out what's just something's not right, talk to me. The link to making a consultation is in my bio. And if you're someone who would wants to give compassionate and comprehensive care to your patients because they are asking for it and you know they are. And you want to make sure that you do it correctly and you want to do it well and you want to make sure your patients have the best outcome, talk to me also because I have a physician course as well. Or for anyone who's a clinician. It does you don't have to be a physician, but often it's physicians who contact me. So again, I'm Dr. Catherine Toomer, and I hope you learned something tonight that will help you in your own health or your patient's health. And I'll talk to you next Tuesday when I should have looked up my guest name before I said that. But anyway, I have a guest next week. So we'll see you next Tuesday on Dr. Toomer Talks. Good night.